terrible state of the NHS is one of the biggest reasons why Keir Starmer's Labour Party won the last election with such a big majority. But the only real strategy that I've seen from Labour for how to improve the NHS and, crucially, how to pay for it, has come from the former Labour Prime Minister Tony Blair. He wants Britain to become the world capital for AI and medical innovation. Tony Blair resigned as Prime Minister in 2007, but he's still one of the most influential people in Britain. His consulting organisation, the Tony Blair Institute, now has an annual turnover of about £100 million and employs more than 800 people, including the former Prime Minister of Finland and the former head of the British Army. On the 9th of July, just days after the 2024 election, he was hosting a conference on the future of Britain with some of the most high-status political and business leaders in the country. Conversation topics included energy, defence, education, but the biggest topic of discussion was the future of the NHS, for two big reasons. Reason number one is simply that the NHS is now at a crisis point across primary care, emergency care, waiting time for surgeries, mental health services, the list goes on. But reason number two is that the NHS could be a catalyst for economic growth without giving up the principle of freely available public healthcare. How can both of these things be true? Well, there is widespread agreement that the NHS needs to get much better at what's called preventative healthcare, which essentially means better early detection of medical problems and making it easier for people to take care of their own health. Not only is that better for patients, it's also much less expensive, and this is an area where AI could have a really powerful impact.
We are living through a time of huge advance in medical science and treatment, all of it accelerated by artificial intelligence and the application of AI to data. For the first time, a healthcare system geared to prevention rather than cure is within our grasp.
The NHS already spends about £70 billion every year on procurement, and there isn't another organisation in the world that rivals it in terms of the quality of its healthcare data. So there's a big opportunity for the NHS to form partnerships with medical AI companies and create products that can improve the quality of healthcare without driving up cost. Listen to the way that Labour's new Health Secretary, Wes Streeting, spoke about this at the Future of Britain conference.
If we can marry our health and social care system with the incredible life sciences and medtech ecosystem we have in this country, we can be a powerhouse for the life sciences and medtech revolution here in this country. And in the world, and that is an economic growth mission.
In theory, this all sounds amazing. We can save the NHS and grow the economy at the same time. But in practice, it's going to be difficult. People will be concerned about the privacy of their medical data, and they'll also be concerned about greenlighting any kind of business relationship between the NHS and private companies. And these concerns are not by any means ridiculous. There have been plenty of examples of the British government screwing up data governance or screwing up contracts with tech companies. But what Tony Blair would argue is that this area where AI meets healthcare is just too important for us to accept that the British government can't do important things well.
This technology revolution is the real world we're going to live in. It will change everything, and positively, if we embrace it in a spirit of innovation, not introspection.